Waverley Care is Scotland's HIV and hepatitis C charity. Since 2004, we've delivered a dedicated African health project to challenge the disproportionate impact of HIV on Africans living in Scotland. Around 1 in 20 Africans in Scotland are living with HIV. Many of them are diagnosed late, with consequences for their health and well-being. Through the African Health Project, we provide information and advice around HIV and sexual health, encouraging people to access testing, preventing new infections, and ensuring that people living with the condition can access the support they need to live well.
Overcoming HIV stigma remains a significant challenge to our work, and we rely on our ability to build strong, trusting relationships with community groups, organizations, and faith groups to reach out to people. Through our work, we've had lots of success building these relationships and have had a real impact on challenging stigma. However, we are keen to explore the opportunity to strengthen the project by investing in how we communicate with people online.
We know from feedback from our service users that they prefer to access information online. At the moment, online information about the African Health Project is only available through the main Waverley Care website. While this gives an overview of what we do, the information on issues like HIV testing aren't specifically for an African audience. We know that this will put people off from finding out more and accessing our services. We want this to change. With funding from Comic Relief's HIV in the UK Think Digital Fund, we want to develop a dedicated website for the African Health Project, with new branding to differentiate it from Waverley Care's other work. Throughout the project, we would work closely with our service users and community partners to make sure the site is relevant to the audience. We would consult with the community to help develop the branding and to identify the type of information and features they would expect to see on the site.
By promoting the African Health Project as its own brand, we had the opportunity to tailor content that is relevant to Africans. This will help to strengthen the credibility of our work among the African community and should lead to increased confidence and engagement in our services. We believe that this is an important next step to our work with African communities, providing a resource that will be relevant to communities across Scotland. This will present opportunities for us to broaden the scope of the service in terms of communities we work in and the services we provide. Ultimately, the new site would make a significant contribution to reducing the health inequalities faced by African communities in Scotland.